Hi friends, welcome to today's video. In this video I am going to discuss pediatric, in that metabolic and endocrine disorders, previous questions which are asked for various exams. We will see first question. A school-age child with type 1 diabetes mellitus has soccer practice 3 afternoon a week. The school nurse provided instruction regarding how to prevent hypoglycemia during practice. Which should the school nurse tell the child to do? Options are: eat twice the amount normally eaten at lunchtime, take half the amount of prescribed insulin on practice, take prescribed insulin at noon time rather in morning, eat a small box of raisins, or drink a cup of orange juice before soccer practice. Correct answer is option D. Eat a small box of raisins or drink a cup of orange juice before soccer practice. Question number 2. The mother of 6-year-old child who has type 1 diabetes mellitus calls a clinic nurse and tells the nurse that the child has been sick. The mother reports that she checked the child's urine and it was positive for ketones. The nurse should instruct the mother to take which action? Options are: A. Hold the next dose of insulin. B. Come to the clinic immediately. C. Encourage the child to drink liquids. D. Administer an additional dose of regular insulin. Correct answer option C. Encourage the child to drink liquids. Question number 3. A healthcare provider prescribes an IV solution of 5% dextrose and half NS, 0.45% with 40 milli equivalent of KCl for child with hypotonic dehydration. The nurse should perform which priority assessment before administration of this IV prescription? Options are: obtains a weight, take the temperature, take the BP, check the amount of urine output. Correct answer option D. Check the amount of urine output. Question number 4. An adolescent client with type 1 diabetes mellitus is admitted to the emergency department for treatment of diabetic ketoacidosis. Which assessment findings should the nurse expect to note? Options are: sweating and tremor, hanger and hypertension, cold, clammy skin and irritability, fruity breath odor and decreasing level of consciousness. Correct answer option D. Fruity breath odor and decreasing level of consciousness. Question number 5. A mother brings her 3 weeks old infant to a clinic for a fetal ketonuria rescreening blood test. The test indicates a serum phenylalanine level of 1 mg per dl. The nurse reviews these results and makes which interpretation? Options are: A. It is positive, B. It is negative, C. It is inconclusive, D. Requires screening at the age of 6 weeks. Correct answer option B. It is negative. Question number 6. A child with type 1 diabetes mellitus is brought to the emergency department by the mother, who states that the child has been complaining of abdominal pain and has been lethargic. Diabetic ketoacidosis is diagnosed. Anticipating the plane of care, the nurse prepares to administer which type of intravenous infusion? Options are: A. Potassium infusion, B. Insulin infusion, C. 5% dextrose infusion, D. NS infusion. Correct answer option D. NS infusion. Question number 7. The nurse has just administered ibuprofen to a child with a temperature of 38.8 degrees Celsius. The nurse should also take which action? Options are: withhold oral fluids for 8 hours, sponge the child with cold water, plan to administer salicylate aspirin, salicylate in 4 hours, remove excess clothing and blankets from the child. Correct answer is option D. Remove excess clothing and blankets from the child. Question number 8. A child has fluid volume deficit. The nurse performs an assessment and determines that the child is improving and the deficit is resolving if which findings is noted. Options are A. The child has no tears. B. Urine specific gravity is 1.030. Option C. Urine output is less than 1 ml per kl per hour. Option D. Capillary refill is less than 2 seconds. Correct answer option D. Capillary refill is less than 2 seconds. Question number 9. A nurse should implement which intervention for a child older than 2 years with type 1 diabetes mellitus who has a blood glucose level of 60 mg per dl? Select all that apply. Options are A. Administer regular insulin. B. Encourage the child to ambulate. C. Give the child a teaspoon of honey. D. Provide electrolyte replacement therapy as IV. E. Wait 30 minutes and confirm the blood glucose reading. F. Prepare to administer glucagon subcutaneously if unconscious occurs. Correct answer is option C. Give the child a teaspoon of honey. Hope everybody understood. Please watch all the videos. Please share to your friends and support me. Subscribe and press the bell icon. Thank you for watching.